As the senior population continues to grow, so does the demand for registered nurses to care for ailing patients. According to the U.S. Bureau of Labor Statistics, employment of registered nurses is projected to grow 19% from 2012 to 2022, faster than the average for all occupations. More than 500,000 positions for registered nurses are projected to open between 2012 and 2022. Also, according to the Bureau of Labor Statistics, 61% of these registered nurses will work in a hospital setting, be it state, local, or private. 7% will work in nursing and residential care facilities. 7% will work in physicians' offices. 6% will work in home health care services, and 6% will work for the government. Choosing the right nurses and staff is an important part of what drives Better at Home and Mederi Caretenders. We sat down with Dr. Kenneth Sampong, Medical Director for the Better at Home and Mederi Caretenders Leesburg office, to talk about the increased demand for qualified and compassionate home health care workers as the baby boomers continue to age.
As far as the aging population and the benefits like home health care is enormous. As you look at it, with the aging population, the baby boomers coming to play, the incidence of heart diseases is going to escalate. We're going to have more and more people winding up with conditions like atrial fibrillation, irregular rhythms of the heart, coronary artery disease, clogged arteries. So even though we are doing better and better at treating patients with heart attacks, what's happening is we are transforming a chunk of those patients into what? Heart failure patients. All these patients that will be taken care of in the hospital, when they get home, we need a partner like Better at Home to help us apply whatever tools that will be available then and now to keep them at home as against overwhelming the hospitals. In what we are actually now terming the transitional care, moving from the hospital and that period of time that patients may otherwise deteriorate and come back to the hospital, home health agencies like Better at Home will play a huge role in preventing that from happening. The number one important role that an agency like Better at Home will help explain to the patients, in my view, will be communication. Here we have Better at Home who have the experienced nurses as well, who when the patient gets that information and gets discharged, within 24 hours or 48 hours, we have healthcare personnel from Better at Home reiterating, reinforcing the communication that was handed to them in the hospital. They need to take the medications, for example, they need to weigh themselves. An agency like Better at Home definitely will be very instrumental to such a new patient. After they've had it once in the hospital and hearing it 3 or 4 times again by home health, I'm sure it will sink in.
Part of the Almost Family network of home health providers, you'll find contact information for Better at Home and Mederi Caretenders when you click on the Compassionate Staff story icon link on our homepage at yourhometownhealth.com.